Medical experts believe funding provision of modern equipment and the establishment of laboratories that can analyze DNA will improve output in the Nigerian medical sector. At a meeting of medical and dental consultants in Yenagoa, they also called on the international oil companies to apply standard practice of exploration to protect the environment. Ovieteme George has details.
The MDCAN National Executive was first received in Government House, Yenagoa, by Deputy Governor Boribio Jonah.
So I want to come with policy ideas that will actually accommodate the inadequacies of our environment, which will continue for some time. We pray that they exit from us within the shortest possible time, but we must also acknowledge that they are part of us. It's our duty to work collectively to see that we get to promised land.
We are aware of the massive investment of the government in the health service in the state, and it is very commendable, as we've also mentioned to His Excellency. Our members are the specialist medical practitioners, and we are ever ready to work with the government, to achieve their health aims.
International best practices in laboratory medicine. Where is Nigeria? Is the theme of the National Executive Council meeting of the Medical and Dental Consultants Association of Nigeria. President of MDCAN, Professor Ngim Ewezum Ngim, prefers solutions for a country far behind in international practices.
Improvement in funding, some have to do improvement in equipment, some have to do with improvement in governance and administration of the various professional groups that work in the laboratory. So all these things have to be done together to achieve better output, better outcomes of practice in that area of medicine.
Invest in the establishment of laboratories that can analyze DNA. It is not a terribly expensive procedure, and once it is in place in a critical number of places in the country, then we will be able to attend to such national issues very quickly.
The establishment of the Bayelsa Health Insurance Scheme. The minimum benefit package is such that it surpasses what obtains nationally. It is when you have built capacity and you have strengthened the institutions that whatever you do will outlive you. And that is what we have done in the states, in the health sector.
A sub-theme of the meeting is oil and gas exploration and health in Nigeria's Niger Delta. The good, the bad, and the ugly addresses environmental problems plaguing Nigeria's oil-rich region, where cases of pollution are frequently recorded.
They have been fishermen and farmers for centuries, and now there is nowhere for them to fish again. Oil companies should be made to operate with the highest standards, the same way they operate in North America and in Europe, so that we do not have spills into the rivers and the lands of the people. If they maintain that, it will help.
The program was hosted by the MDCAN Federal Medical Center, the Niger Delta University Teaching Hospital, and the Bayelsa State Government. Ovieteme George, TVC News, Yenagoa, Bayelsa State.